know that it's important to eat enough protein, but if we eat majority of our protein from animal products, it does not increase the risk of cardiovascular diseases. So let's take a look at a few of those interesting studies. For example, with butter, the idea that saturated fat causes heart disease, as we mentioned, called the diet heart hypothesis, was started in the 50s. And they found there are several studies that found correlation between plasma cholesterol levels and heart disease risk. And butter consumption has been consistently associated with risk of cardiovascular outcome due to the focus on cholesterol levels. However, long-term effects of butter consumption on other major endpoints, such as all-cause mortality and cardiovascular diseases, are not well established. There was a systematic review with meta-analysis, including 15 country-specific cohorts, together reporting on over 636,000 unique participants with 6.5 million person years of follow-up, reported that butter consumption was not significantly associated with any cardiovascular disease, coronary heart disease, or stroke. There was also a weak association with all-cause mortality and inversely associated with incidence of diabetes. And so this is overall a good news for anybody that likes to eat butter. And of course, we're talking about consumption of butter in moderation. And it's important to understand that when we eat butter, it will increase the amount of cholesterol in our bloodstream, but so does other fats, right? Like eating coconut oil, for example, will also increase our amounts of cholesterol in our bloodstream. But the end result, which is cardiovascular death, end result, the butter was not found to be associated or significantly associated with cardiovascular disease, coronary heart disease, or stroke. So if any of you loves butter, I personally eat butter in very small amounts, here and there in some dishes that I enjoy it. So just important to know that butter is not necessarily the enemy. We have to look at the whole picture. We have to look at consumption of fiber, vegetables, inflammatory markers, and environmental chemicals, gut health. We have to look at the whole matrix, the entire comprehensive approach to that. And then when we look at egg consumption, I know that eggs had really bad reputation for years. I've been hearing from patients and dietitians telling us about how eggs are dangerous because they elevate cholesterol levels. So the observational prospective study, we've not found, for the most part, a direct relationship between egg consumption and blood cholesterol or cardiovascular disease risk. A study published in 2020 evaluated egg consumption and cardiovascular disease in individuals from 21 countries in a 9-year follow-up. The results showed that higher egg intake, which means 7 or more eggs per week, let's say 1 egg every day, in comparison to less than 1 egg a week, was not significantly associated with blood lipids, including total cholesterol, HDL, LDL, total cholesterol, HDL ratio, triglycerides, apolipoprotein A1 or B, and total mortality or major cardiovascular diseases. Several authors have attributed this protective effect of eggs to the egg's anti-inflammatory property and vitamin, mineral, and antioxidant content. So eggs could be beneficial. Eggs are a really good source of protein. You have about 6 grams of protein in each egg, and that's considered to be a very high quality protein. And so 1 egg a day was not significantly associated with negative changes to blood lipids or major cardiovascular diseases. These are some of the sources. And then when we talk about high meat diet, reduction in intake of dietary fiber is associated with reduced bacterial diversity and production of short-chain fatty acid, such as butyrate, which is really, really important. But it's also important to mention that, as we mentioned before, the high-rich diet containing L-carnitine, phosphatidylcholine can cause alternation in the gut, which leads to an increase of the TMA. TMA is basically converted in the liver into TMAO, which increases the atherosclerosis process. And again, it also causes the change in the gut bacteria due to high meat consumption can also causes an increase in certain bacteria that can then translocate from the gut into the bloodstream. This is important to know because I've seen people that do better on paleo when they combine some fruits and vegetables, so they still maintain some level of consumption of fiber. But I've also seen patients that when they went on a paleo diet, which is high protein, high animal protein, I've seen patients that completely derail in terms of their health and just suddenly suffer from more inflammation or struggle with more digestion problems. And that includes patients that have fatigue, brain fog, arthritis, autoimmune conditions. So always be aware of that if the patient is consuming high animal protein, high amounts of, on a regular basis, consumes chicken, beef, pork, these can, through the changes in the gut, can lead to more inflammation and more metabolic waste. So of course, if somebody really insists on paleo, because paleo does have a few beneficial properties to it, such as reduction. When you reduce carbs, you're obviously going to lose some weight. We will typically recommend to do a more healthy version of paleo, which is still eating vegetables with every meal. But if you do one day you eat a burger, then the other day you're going to eat fish. And then the other day you're going to eat beans and legumes. So you want to have a diverse diet and not just rely on meat, chicken, and pork, but change your diet every day to make sure that it's diverse, and you get also omega-3s, you get also other foods to maintain a healthy gut diversity. Because when you change your diet, you are going to change your gut diversity, your bacteria, the diversity of the gut bacteria. So that's really important to make sure that you have a healthier diet.